As we grow older, we become more mindful of our health. We take medications to control blood pressure, ease pain, improve sleep, and manage chronic conditions. These pills promise relief, stability, and a better quality of life. But what if some of them are silently working against your brain? What if the very medications meant to help you are quietly increasing your risk of memory loss, confusion, and even dementia? This is not about fear. It's about awareness, because after 60, your brain becomes more sensitive, more vulnerable, and more dependent on what you put into your body every single day. Let's begin with something many people don't realize. Certain medications interfere with a key brain chemical called acetylcholine. This chemical is essential for memory, learning, and clear thinking. When medications block it, the brain struggles to function properly. Over time, this can mimic or even accelerate symptoms that look like dementia. The first group to be cautious about is anticholinergic drugs. These are commonly found in medications for allergies, bladder control, and even sleep aids. They may seem harmless, something you can buy over the counter, but long-term use has been strongly linked to cognitive decline. If you often feel foggy, forgetful, or mentally slow, this could be a hidden cause. Next are sleeping pills and sedatives, especially those used regularly. Many older adults rely on them to get through the night, but these drugs can suppress brain activity, reduce alertness, and interfere with memory formation. Instead of restoring your mind, they may be dulling it. The danger increases when they are used nightly without review. Now comes the one you need to pay immediate attention to, #3-benzodiazepines. These are powerful medications often prescribed for anxiety, stress, or insomnia. Names vary, but their effect is similar. They calm the nervous system. The problem is, they also slow down brain function significantly. Long-term use has been associated with a much higher risk of dementia. They can cause confusion, poor coordination, and memory gaps even in the short term. If you or someone you love is taking one regularly, this is not something to ignore. It must be discussed with a doctor as soon as possible. Moving on, we have opioid painkillers. These are often prescribed after surgeries or for chronic pain. While effective, they can cloud thinking, reduce attention, and impair memory. Over time, this mental fog can become more persistent, especially in older adults. Another category includes certain antidepressants, particularly older types like tricyclic antidepressants. While they help regulate mood, they can also have anticholinergic effects, which, as mentioned earlier, interfere with brain chemistry linked to memory. Then, there are antihistamines, commonly used for colds, allergies, or even as sleep aids. Many people don't realize that these drugs can cross into the brain and affect cognition. Taking them frequently may contribute to long-term mental decline. Blood pressure medications, particularly when they lower pressure too much, can also play a role. The brain needs a steady supply of oxygen, rich blood. If blood pressure drops excessively, it may reduce that supply, leading to dizziness, confusion, and over time, potential cognitive issues. We also need to talk about proton pump inhibitors, used for acid reflux and heartburn. While generally considered safe, long-term use has been linked in some studies to increased risk of cognitive decline, possibly due to nutrient deficiencies like vitamin B12. Lastly, muscle relaxants often prescribed for back pain or injuries can sedate the brain and impair coordination and memory, especially when used regularly. Here's the truth. It's not that all these medications are bad. Many are necessary, many save lives. But the danger lies in long-term unmonitored use, especially when multiple medications are combined. After 60, your body processes drugs differently. your liver and kidneys slow down. Medications stay in your system longer. Interactions become more dangerous, and your brain becomes more sensitive to their effects. So what should you do? Start by reviewing every medication you take, prescription and over-the-counter. Don't stop anything suddenly, but ask questions. Why am I taking this? Is there a safer alternative? Do I still need it? Focus on lifestyle changes where possible. Improve sleep naturally. Manage stress through movement and breathing. Eat brain-supporting foods. Stay mentally and socially active. Because protecting your brain is not just about avoiding disease, it's about preserving your independence, your memories, your identity. You've worked your entire life to build your experiences, your knowledge, your story. Don't let something as small as an overlooked pill slowly take that away. Stay aware, stay informed. And most importantly, stay in control of your health. Hidden medication risks after 60 often go unnoticed because most people trust that if a drug is prescribed or available over the counter, it must be safe for long-term use. The reality is more complex. As the body ages, it undergoes physiological changes that directly affect how medications are absorbed, distributed, metabolized, and eliminated. The liver and kidneys, which are responsible for breaking down and clearing drugs, tend to function more slowly, allowing substances to remain in the body for longer periods. This increases the likelihood of accumulation and intensifies side effects that may have been mild or unnoticeable earlier in life. At the same time, the brain becomes more sensitive to chemical changes, making it easier for certain medications to interfere with memory, focus, and overall cognitive clarity. One of the most overlooked dangers comes from polypharmacy, a situation where an individual takes multiple medications simultaneously. This is common after 60, as people often manage several chronic conditions such as hypertension, diabetes, arthritis, and sleep disturbances. While each medication may be appropriate on its own, the combination can create interactions that amplify negative effects on the brain. These interactions can lead to confusion, dizziness, and memory lapses that are sometimes mistaken for early dementia rather than recognized as medication-related issues. The more medications a person takes, the harder it becomes to identify which one is causing the problem, allowing the damage to continue quietly. Another hidden risk lies in medications with anticholinergic properties. These drugs block acetylcholine, a neurotransmitter essential for learning and memory. Even medications that are not primarily intended to affect the brain can have these properties, including certain allergy treatments, bladder control drugs, and older antidepressants. Regular use can gradually impair cognitive function, leading to symptoms such as forgetfulness, difficulty concentrating, and mental fatigue. Because these changes often occur slowly, they are frequently attributed to normal aging rather than recognized as a preventable side effect. Sedative medications also pose a significant threat. Drugs used for anxiety, insomnia, or muscle relaxation can depress the central nervous system, reducing alertness and slowing reaction times. In older adults, this not only increases the risk of falls and injuries, but also affects the brain's ability to process and retain information. Sleep induced by these medications is often not the same as natural restorative sleep, meaning the brain does not get the full benefit of overnight recovery. Over time, this can contribute to a persistent sense of mental fog and reduced cognitive resilience. Pain management medications, particularly stronger ones, add another layer of risk. While they are often necessary for maintaining quality of life, they can also alter brain chemistry and impair judgment and memory. Long-term use can lead to dependency and further complicate cognitive health, especially when combined with other sedating drugs. Even common medications for heartburn or blood pressure, when used without regular monitoring, can indirectly affect the brain by altering nutrient absorption or reducing blood flow to critical areas. A critical factor that makes these risks more dangerous is the assumption that over-the-counter medications are harmless. Many people take antihistamines, sleep aids, or cold remedies without consulting a healthcare provider, unaware that these products can have strong effects on the brain. Because they are easily accessible, they are often used more frequently and in higher doses than recommended, increasing the potential for harm. This self-medication habit can quietly contribute to cognitive decline over months or years. Dehydration and poor nutrition can further amplify the effects of medications. After 60, the sense of thirst may diminish and dietary habits may change, leading to deficiencies that make the brain more vulnerable. When combined with medications that already stress the system, this creates a situation where even standard doses can have exaggerated effects. The result is a cycle where symptoms like confusion or fatigue lead to more medications, which in turn worsen the underlying issue. Awareness is the first step in reducing these hidden risks. Regular medication reviews with a healthcare professional can help identify unnecessary drugs, adjust dosages, and find safer alternatives. It is important to report any changes in memory, mood, or mental clarity, even if they seem minor, as these can be early signs of medication-related problems. Keeping a detailed list of all medications, including supplements and over-the-counter products, ensures that nothing is overlooked during consultations. Ultimately, the goal is not to avoid medications altogether, but to use them wisely and intentionally. Understanding that the body and brain respond differently after 60 empowers individuals to take a more active role in their health care. By staying informed and vigilant, it becomes possible to protect cognitive health while still benefiting from the treatments needed to maintain overall well-being. Protecting brain health and memory after the age of 60 becomes one of the most important investments a person can make in their overall quality of life, because the brain is not just another organ, it is the center of identity, independence, and daily function. As the years pass, natural changes occur in the brain, including slower processing speed, reduced neurotransmitter activity, and gradual shrinkage in certain areas associated with memory. While these changes are normal, they do not mean that decline is inevitable or irreversible. In fact, the brain has a remarkable ability to adapt and reorganize itself, a concept known as neuroplasticity, which allows it to build new connections and maintain function when given the right support. One of the most powerful ways to protect the brain is through consistent mental stimulation. Just like muscles, the brain becomes stronger when it is challenged. Activities such as reading, solving puzzles, learning new skills, or even engaging in meaningful conversations can help maintain cognitive sharpness. The key is variety and novelty, because doing the same task repeatedly offers less benefit than exposing the brain to new information and experiences. Learning a new language, picking up a musical instrument, or even navigating unfamiliar places can activate different regions of the brain and encourage the formation of new neural pathways. Physical activity plays an equally critical role in maintaining memory and cognitive function. Exercise increases blood flow to the brain, delivering oxygen and essential nutrients that support cell health and communication. It also promotes the release of growth factors that help protect existing neurons and encourage the development of new ones. Even moderate activities like walking, stretching, or light strength training can have a meaningful impact when done consistently. Movement also helps regulate blood pressure, blood sugar, and cholesterol levels, all of which are directly linked to brain health and the risk of cognitive decline. Nutrition is another cornerstone of protecting the brain. The foods consumed daily provide the building blocks for brain cells and influence inflammation levels throughout the body. Diets rich in fruits, vegetables, whole grains, healthy fats, and lean proteins supply antioxidants and essential nutrients that support cognitive function. Omega-3 fatty acids found in fish, nuts, and seeds are particularly important because they contribute to the structure of brain cell membranes and support communication between neurons. At the same time, reducing processed foods, excessive sugar, and unhealthy fats can help minimize inflammation, which has been associated with memory problems and neurodegenerative conditions. Sleep is often underestimated, yet it is one of the most vital processes for memory preservation. During sleep, the brain consolidates information, clears out waste products, and resets neural activity for the next day. Poor or insufficient sleep can disrupt these processes, leading to forgetfulness, difficulty concentrating, and reduced problem-solving ability. Establishing a consistent sleep routine, creating a comfortable sleep environment, and avoiding stimulants before bedtime can significantly improve sleep quality and, in turn, cognitive health. Social connection is another powerful but sometimes overlooked factor. Human interaction stimulates multiple areas of the brain, including those responsible for language, emotion, and memory. Engaging with friends, family, or community groups can reduce feelings of isolation and depression, both of which are linked to cognitive decline. Meaningful relationships provide emotional support and encourage mental engagement, helping to keep the brain active and resilient. Managing stress effectively is also essential for protecting memory. Chronic stress leads to prolonged exposure to cortisol, a hormone that can negatively impact the brain, particularly areas involved in learning and memory. Over time, high cortisol levels can weaken neural connections and make it harder to retain information. Techniques such as deep breathing, meditation, mindfulness, or spending time in nature can help regulate stress levels and create a more balanced mental state. Regular health monitoring plays a crucial role as well. Conditions like high blood pressure, diabetes, and high cholesterol can damage blood vessels and reduce blood flow to the brain, increasing the risk of cognitive impairment. Keeping these conditions under control through proper treatment and lifestyle adjustments helps maintain a stable environment for brain function. It is equally important to review medications regularly, as some drugs can interfere with memory and cognition, especially when taken in combination. Hydration is another simple yet effective way to support brain health. Even mild dehydration can affect concentration, alertness, and short-term memory. Drinking enough water throughout the day ensures that the brain remains well supplied and capable of functioning efficiently. Combined with balanced nutrition, proper hydration helps maintain the chemical balance necessary for optimal cognitive performance. Ultimately, protecting brain health and memory is about creating a lifestyle that consistently supports mental function from multiple angles.